Today in this video we are going to talk about Pseudomonas aeruginosa. So Pseudomonas aeruginosa is the gram-negative rod. It is aerobic, it is motile, and it is catalase positive. It is also oxidase positive. So the Pseudomonas aeruginosa is the gram-negative rod, which is the aerobic, motile, catalase positive, and oxidase positive organism. So the order of the Pseudomonas aeruginosa, it gives grape-like order. So what is the Pseudomonas aeruginosa is associated with? The Pseudomonas is associated with pneumonia, sepsis, ecthyma, urinary tract infection, diabetes, osteomyelitis, mucoid polysaccharide capsule. The mucoid polysaccharide capsule is the one that is responsible for the chronic pneumonia. It is also associated with the otitis externa. The otitis externa due to Pseudomonas aeruginosa we called is that swimmer's ear. It is associated with the nosocomial infection and it is also associated with the addicts. Pseudomonas aeruginosa bacteria produces PEEP, namely phospholipase C. So this phospholipase C degrades the cell membrane and the endotoxin causes fever and shock. The exotoxin A inactivates elongation factor 2 and the various clinical manifestation occurs. The pigment mainly produced by the Pseudomonas aeruginosa are pyoverdin and pyocyanin. Those are the blue-green pigments, and it also generates the reactive oxygen species. If we look at the contact lens wearers, if there is minor eye trauma, the Pseudomonas aeruginosa causes corneal ulcer and keratitis. Now let us talk about the ecthyma gangrenosum. Ecthyma gangrenosum is the rapidly progressive chronic necrotic cutaneous lesion. So I am going to show here this picture of the ecthyma gangrenosum. So you can see in this picture is that there is necrotic cutaneous lesion. This necrotic cutaneous lesion is rapidly progressive and it is mainly caused by the Pseudomonas bacteremia. So this ecthyma gangrenosum lesion is typically seen in the immunocompromised patients. So the treatment of the Pseudomonas aeruginosa. The treatment of the Pseudomonas aeruginosa is done by the carbapenem, aminoglycosides, monobactams, polymyxins, fluoroquinolones, third and fourth generation cephalosporins. The third and fourth generation cephalosporin includes ceftazidime, cefepime, and extended spectrum penicillin. So these are the drugs that are used for the treatment of Pseudomonas aeruginosa infection. So after the Pseudomonas aeruginosa infection, we are going to talk about Salmonella and Shigella. I am going to briefly explain about the Salmonella and Shigella. The Salmonella and Shigella are the gram-negative rods. They are the non-lactose fermenter, oxidase negative, and can invade the gastrointestinal tract via the M cell of the pear patches. So in the next video, we are going to talk about Salmonella and Shigella. Today we talked about the Pseudomonas aeruginosa. Again, I am going to summarize the topic. The Pseudomonas aeruginosa are the gram-negative rod. They are the aerobic, motile, catalase positive, and the oxidase positive. They are mainly associated with the you can also remember this Pseudomonas is the mnemonics, like P stands for pneumonia, S stands for sepsis, E for ecthyma, U for UTI, D for diabetes, O for osteomyelitis, M for mucoid polysaccharide capsule, O for otitis externa, and N for nosocomial infection, and A for addicts. So you have to know about the ecthyma gangrenosum. These are the rapidly progressive necrotic cutaneous lesion causes mainly by the Pseudomonas bacteremia, and these are the various bacteria that are used for the treatment of the Pseudomonas aeruginosa infection. I hope you understood this lecture. Thank you.